Let's get started. This is extremely dangerous and should never be attempted in real life. Forcing your eyes to remain open without blinking can cause severe corneal damage, permanent vision impairment, and potentially blindness. This video is purely educational. Right now, as you watch this video, your eyes are performing one of the most frequent yet overlooked actions in your entire body: blinking. You blink approximately 15 to 20 times per minute, totaling nearly 28,800 times every single day. But what if you decided to stop this automatic behavior for just 24 hours? The answer involves more pain, tissue damage, and permanent consequences than you might imagine. Today, we're exploring why this simple reflex is absolutely critical for your survival, and what happens when you deny your eyes this essential protection. Understanding why your eyes need to blink. Before we subject your eyes to this torturous experiment, you need to understand what blinking actually accomplishes, and why evolution made it such a frequent automatic behavior. Blinking isn't just a nervous habit, it's a sophisticated maintenance system that keeps your eyes healthy, functional, and protected through multiple critical mechanisms. Every time you blink, your eyelids perform a precise sweeping motion that distributes a microscopic film of tears across your entire cornea. This tear film is only about 7 micrometers thick, thinner than a human hair, yet it consists of 3 distinct, essential layers. The innermost mucin layer helps tears adhere to your eye surface, preventing them from sliding off. The middle aqueous layer provides hydration, oxygen, and vital nutrients that your cornea needs to survive. The outer lipid layer, secreted by meibomian glands in your eyelids, prevents evaporation and maintains optimal surface tension. Your cornea, the clear front window of your eye, is one of the most sensitive tissues in your body, containing more nerve endings per square millimeter than almost anywhere else. Crucially, it's also avascular, meaning it has no blood vessels to deliver oxygen and nutrients. Instead, your cornea relies entirely on the tear film and dissolved oxygen within it to stay alive. Without regular blinking to refresh this life-sustaining film, your cornea literally begins to suffocate. The blink reflex occurs in just 100 to 150 milliseconds, making it one of your fastest protective responses. Research shows that your brain actually enters a momentary resting state during each blink, a micronap that resets your attention and visual processing. Your eyelids also act as mechanical wipers, clearing away microscopic debris, dead cells, and potentially harmful microorganisms that could cause serious infections. This automatic behavior happens so seamlessly that your brain suppresses visual processing during blinks through a phenomenon called saccadic masking, meaning you're essentially blind for about 10% of your waking hours without ever noticing. Within the first 30 seconds of not blinking, your eyes begin sending urgent distress signals to your brain. The tear film that was evenly distributed across your cornea during your last blink starts breaking up and evaporating. Normal tear film remains stable for only 10 to 15 seconds before it begins deteriorating, so you quickly feel increasing dryness and discomfort as exposed patches of cornea come into direct contact with air. By the 2-minute mark, the discomfort intensifies dramatically. Your eyes begin to burn like fire as the protective tear film breaks down completely in certain areas, creating dry spots where your corneal nerve endings are directly exposed. Your body recognizes this as a threat and triggers reflex tearing, flooding your eyes with tears in a desperate attempt to compensate. However, these emergency tears are mostly water and salt, lacking the complex composition your eyes need, and without blinking to distribute them, they simply pool uselessly or stream down your face. Around the 5-minute point, the pain becomes severe and constant. Your corneal nerve endings are firing distress signals relentlessly, creating a sensation that patients describe as sand or glass shards under your eyelids. The urge to blink is now overwhelming. Your brain is screaming at you to protect your eyes through one of the most powerful reflexes in your body. Resisting this urge requires intense mental effort and creates significant psychological stress as you fight against millions of years of evolutionary programming. Within the first few hours, visible changes occur that others would notice. Your eyes become bloodshot, as blood vessels in the conjunctiva dilate massively, attempting to bring immune cells and nutrients to your suffering eye surface. Your vision becomes significantly blurred because the irregular, deteriorating tear film can no longer properly refract light. You develop severe photophobia, Normal indoor lighting feels like staring directly into the sun, causing headaches and nausea as your unprotected corneas react to light exposure. By the end of day 1, your corneas have sustained actual tissue damage. The outermost layer of your cornea, called the epithelium, begins to desiccate and die. These epithelial cells, which normally shed and regenerate regularly with the help of blinking, start sloughing off in irregular patches. This process, called corneal epithelial erosion, creates microscopic wounds across your eye surface that are excruciatingly painful. Within the first 12 hours, the damage progresses to a condition similar to severe dry eye syndrome, but accelerated and intensified far beyond normal limits. Your corneas develop multiple areas of punctate keratitis, tiny spots of inflammation and cell death that appear as dots under medical examination. These damaged areas become entry points for bacteria and other pathogens, significantly increasing your risk of serious eye infections like bacterial keratitis, which can lead to permanent vision loss. The pain at this stage is nearly unbearable because corneal pain is unique in its intensity. The high density of pain receptors creates sensations often described as worse than many other types of injury. You're experiencing constant burning, stabbing, and foreign body sensations while your eyes produce tears continuously. Yet they provide no relief because they're not being properly distributed. The psychological toll becomes immense as the overwhelming urge to blink creates a mental battle that consumes all your attention and willpower. Around the 18-hour mark, your vision has deteriorated significantly. The irregular corneal surface and ongoing epithelial damage create severe visual distortions. You might see halos around lights, experience double vision, or find that objects appear foggy and unclear. The inflammation in your eyes reaches critical levels, with corneal swelling, as damaged cells leak fluid into surrounding tissue. Your conjunctiva may appear gelatinous or swollen in a condition called chemosis, and you're experiencing severe headaches from the constant pain signals flooding your nervous system. If you somehow made it to day 3 without blinking, your eyes would feel like someone poured salt and acid into them while turning on industrial fans. The chronic breakdown of your tear film has created extensive areas of corneal epithelial loss, exposing the underlying stroma, the structural middle layer of your cornea, directly to air and environmental contaminants. Congratulations! If you somehow made it to day 5. But here's what your body is going through. You've entered a phase of structural damage where the outer layer of your cornea has sloughed off in large patches, creating a condition similar to severe chemical burns. Your eye surface is now covered in thousands of tiny open wounds that serve as breeding grounds for dangerous bacteria. The risk of infection has become the primary threat to your vision and potentially your life. Normally, tears contain lysozyme and other antimicrobial substances that kill bacteria. But without fresh tears and the mechanical flushing action of blinking, harmful microorganisms are multiplying rapidly on the warm, dying surface of your eye. You're at extremely high risk for bacterial keratitis, fungal infections, or viral complications that could spread to deeper eye structures. At this point, most people would give up due to the excruciating pain. But if you were somehow forced to continue, your vision would be like looking through a heavily frosted window. Your corneas, usually crystal clear, have become edematous and cloudy with inflammation. The constant pain signals from your trigeminal nerve can trigger severe migraines and even cause your brain to misinterpret damaged visual signals, potentially leading to hallucinations as your visual cortex struggles to process the corrupted information from your eyes. At the 1-week mark, the damage is becoming irreversible. The open sores on your corneas have likely deepened into corneal ulcers, crater-like wounds that eat into the structural layers of your eye. This represents a medical emergency that could lead to perforation of your cornea, allowing the contents of your eye to leak out. Entering the danger zone at week 2, your body attempts a desperate last-ditch effort to save your eyes through neovascularization. Since your corneas aren't getting oxygen from the air anymore, your body begins growing new blood vessels from the white of your eye into the normally clear cornea. While this is an attempt to keep the tissue alive, it's disastrous for your vision because these blood vessels create permanent scars that block light transmission. Visible changes others would notice include permanently red, inflamed eyes that may be crusted over with dried discharge and pus. You're likely squinting constantly or keeping your eyes partially closed even in normal lighting. Your eyes require manual cleaning that is excruciatingly painful, and you're completely incapacitated for most daily activities, unable to read, look at screens, or navigate safely. The social and lifestyle impacts are devastating. You cannot work, study, or engage in most normal activities. The constant, debilitating pain makes sleep nearly impossible, and you're likely experiencing significant depression and anxiety from the chronic suffering and loss of independence. At this stage, you're facing the risk of permanent damage that will affect the rest of your life, even if the experiment stops immediately. If this torture continued for months, you would be facing total ocular failure. The corneal ulcers would likely progress to perforation, literally creating holes in your eyes. When the cornea ruptures, the aqueous humor, the fluid inside your eye, leaks out, and internal structures like your iris can be sucked into the wound, causing catastrophic damage to your eye's anatomy. Serious health complications at this stage include endophthalmitis, a severe inflammation of your eye's interior that often leads to surgical removal of the eyeball to prevent the infection from spreading to your brain via the optic nerve. The quality of life deterioration is complete. You would be facing permanent blindness, chronic pain, and the need for multiple surgical interventions just to manage infection and prevent life-threatening complications. Even if your eyes don't rupture, your corneas would undergo keratinization, essentially transforming from clear, moist tissue into skin-like material to protect against the chronic dryness. This creates thick, white, completely opaque layers that render you permanently blind. Medical intervention at this point focuses not on saving vision, which is impossible, but on managing pain and preventing systemic infection that could threaten your life. In the worst-case scenario of indefinite blink deprivation, you're left with two non-functioning, likely infected, and structurally collapsed organs where your eyes used to be. The pain might actually decrease at this extreme stage, but only because the corneal nerves have been completely destroyed, a sign of total tissue death, rather than any improvement. This scenario mirrors the most severe cases of conditions like Stevens-Johnson syndrome or extreme vitamin A deficiency, where eyes dry out completely and cease to function. The point where this experiment becomes dangerous isn't measured in weeks or months. It becomes life-threatening within the first 24 to 48 hours due to the risk of serious infection that could spread systemically. When you finally allow yourself to blink after 24 hours, the immediate sensation combines relief with intensified pain. Your first blink will be agonizing because your eyelids, likely stuck to the dried corneal surface, will mechanically scrape off additional epithelial cells as they move. This creates fresh abrasions on top of existing damage. Over the first few hours of resumed blinking, your tear production gradually normalizes, and the constant flushing begins clearing debris and dead cells from your eye surface. However, the pain persists and may actually intensify as healing begins and inflammation peaks. You'll need artificial tears every 15 to 30 minutes to support recovery, and even simple activities like reading or using screens will be impossible for days. The recovery timeline depends on damage severity, but superficial corneal epithelial damage typically heals within 3 to 7 days. However, the extensive damage from 24 hours without blinking extends much deeper, requiring 2 to 4 weeks for complete healing. During this time, you remain at high risk for recurrent corneal erosions, where the damaged epithelium spontaneously detaches months or even years later, causing sudden episodes of severe pain. Any corneal scarring that developed during your experiment is permanent. While minor scars might not significantly impact vision, moderate to severe scarring requires treatments like phototherapeutic keratectomy or even corneal transplantation to restore functional vision. Real-world context. While this extreme experiment is hypothetical, medical conditions that impair blinking provide real-world evidence of these consequences. Patients with legophthalmos, inability to close eyelids completely, or facial nerve paralysis experience chronic corneal damage requiring aggressive treatment with artificial tears, moisture chamber goggles, and sometimes surgical intervention. Research shows that even reduced blink rates cause measurable problems. Studies have found that people blink only 7 times per minute when staring at screens compared to the normal 15-20 times. and this reduction alone causes dry eye symptoms and corneal stress. The documented world record for not blinking under controlled conditions is just over 1 hour, and even this brief period causes significant discomfort and temporary vision changes. Medical professionals consistently emphasize that the cornea has limited regenerative capacity, and severe or repeated damage leads to permanent vision loss. Ophthalmologists warn that any behavior preventing normal blinking is extremely dangerous and can cause irreversible harm to one of your most precious senses. Conclusion: your automatic, unconscious blink reflex represents millions of years of evolutionary refinement designed to protect your vision. Those 28,800 daily blinks maintain eye health, prevent infection, deliver essential nutrients, and shield your eyes from countless environmental threats every moment of every day. This hypothetical experiment would result in severe corneal damage, excruciating pain, temporary vision loss, and potentially permanent scarring within just 24 hours. Never attempt to prevent normal blinking for any extended period. This is purely educational content, highlighting the critical importance of this essential biological function. Appreciate every effortless, automatic blink as a gift that preserves one of your most valuable senses. Your eyes depend on this simple, yet sophisticated protective mechanism, and respecting its importance is essential for maintaining your vision throughout your life.